Hi, Keith. Thank you for coming in today. How are you today?
Good. How are you?
I'm doing great. Thank you. Let's go ahead and get started with our interview, if that's okay.
Okay.
All right, great. All right, so tell us about yourself. Briefly describe your professional interest and experiences.
All right. So I started in the healthcare industry in 2012. I started working as an EMT at a transport service. So
Mm-hmm.
we would transport critically ill patients from hospitals to other healthcare facilities, just making sure they were stable, maintaining their vitals, and just ensure a safety transport.
Mm-hmm.
After that, I wanted to get more clinical experience. So I started working at Legacy Community Health Services. I was floating between adult medicine and the on-site lab that they had there. Um, Shortly after I started working there, I became the lead MA in the lab. So I was able to supervise and ensure proper workflow between the other MAs working there, the lab technicians, and just ensure that proper specimen handling processing was going on,
Mm-hmm.
and providers were getting the patient's lab work back
Mm-hmm.
um, efficiently and effectively. And then after that, I began working at MedSpring Urgent Care. I've been there for just over 3 years now. Um, There, we usually see patients with minor illnesses and injuries. We also see patients for occupational related issues. While I've been working there, I've also took prereqs for nursing, and I'm currently enrolled in a BSN program at the University of Texas at Arlington. As far as my nursing career, I really want to get involved with emergency in the emergency field. Long term, I think I want to go into oncology and work with pediatrics.
Wow. Okay. Great. Well, I see that you do have some great experience already in the healthcare industry. All right. So next, where do you see yourself in your career in 5 to 10 years?
In 5 to 10 years, I want to be working at MD Anderson. Like I said before, I want to get involved in oncology and I want to work with pediatrics. I also want to, sometime between 5 to 10 years, start working on advancing my career as either a nurse practitioner or starting a CRNA program.
All right. Well, great. Those are great goals to have. All right. What previous job was the most satisfying to you and why?
I think I got the most job satisfaction from um, my time as lead MA at Legacy Community Health Services.
Mm-hmm.
Um, we were just able to provide services for patients who um, didn't necessarily have a lot of income, had little to no insurance, and we provided services that they normally wouldn't get. I was also able to really practice my leadership skills and use them for really the first time. I was able to ensure proper workflow, ensure patient satisfaction, and ensure that their labs were being processed correctly. I was able to implement a database where the MAs and techs could go look at if they were unsure of a blood draw or how to process the specimen. And because of all of this, labs were coming back more accurately and effectively, and it really did help with the patient care.
Wow, that's great. I can definitely see where that would be a really rewarding and satisfying place to work.
Hmm.
Okay, so next, talk to us about the value of teamwork. What did you do in your last job to contribute towards teamwork in an environment?
Well, I think in any workplace setting, teamwork is essential.
Right.
At my current job, it's usually just me working as an MA. We have an X-ray tech, and then we also have one provider working. So usually it's just three of us working in a center, and most of the time we get really busy. So we have to work together in order to have a function uh, workplace.
Mm-hmm.
Um, so I know that I can go to the back and go to the exam room, vital some patients, assess them, or help the provider with a procedure.
Right.
And also, I know I can go to the front and help with a check-in if I need to. I also think it's important to know your own strengths and weaknesses. Knowing when you can step in and help, and then also knowing when to ask for help. I think that also helps with teamwork in the workplace.
Yeah, I couldn't agree with you more. I think it's great that you understand the importance of teamwork in whatever work environment that you're in. All right. So, lastly, tell us about a situation in which you had to speak up or be assertive in order to advocate for a patient or idea, or in order to get an important point across.
So one time I really had to step up and voice my concerns and advocate for a patient was last semester during our critical care rotations. I had a patient who had been admitted because she was having lower leg weakness. She said that she had been coughing up blood, and she also had a history of breast cancer, so she had a portacath inserted.
Mm-hmm.
So nobody ever saw her cough up blood. She was able to walk around her room with very little assistance. She'd go to the restroom by herself, walk around her room. There was a time I went in to assess the patient. Her IV was disconnected from her port, and it was just on the floor leaking everywhere.
Wow.
Her When I was assessing her, then her port had been locked, and the line was filled with blood. So between all this suspicious activity and different things that she had been telling me, something just didn't sit right with me, and things weren't adding up with what she was saying. So I voiced my concerns to the nurse I was working with, and effectively communicated my concerns with the charge nurse. And she went ahead and did an assessment on the patient, and she was able to find some dirty syringes on her that she had been using to draw blood out of her port, which caused an infection. So by effectively communicating, I was able to advocate for the patient's safety, and the healthcare team was able to determine the cause of her infection and better determine a course of treatment for this patient.
Wow. Well, that's a good thing that you caught that and were able to report it to the appropriate personnel.
Mm-hmm.
All right. Well, that's all that I have for today. Do you have any questions for me?
No, not right now.
All right. Well, thank you so much again for coming in for our interview, and I look forward to talking to you really soon.
All right. Well, thank you.
Thank you.